October 5th, 2004, I was diagnosed with oral cancer, squamous cell carcinoma. It was at the base of my tongue. When they removed the tumor, it was about the size of my thumb. I had 9-hour surgery.
Yep.
And
it was a long day.
Yeah. After that, I had 31 radiation treatments and 2 chemotherapy treatments along with the surgery. We were a year married,
yeah,
just a year.
Just over a year married.
We just had bought a house.
Just bought a house. 2 days before his surgery, we found out we were expecting baby number 1.
Yeah.
So it almost gave you hope in terms of, I have to get through this because I have a baby on the way. And I know a lot of people had said that to you.
Yeah.
You know, you have to get through this because there's a baby coming, you have to be around. And
Craig is someone I met, he may correct me on this, I'd say 7 years ago, after much of his treatment had taken place, and his recovery was taking, quite understandably, a year longer. And as is very often the case, treatment of a potentially scary disease, or a scary disease, isn't the only thing that's going on in the person's life. There was a new arrival to the family anticipated just during this very time. So life is complex and sometimes complicated.
A few years ago, I would go in and visit Dr. Sully, have an hour appointment, hour and a half an hour, whatever I needed. But with a busy family, it's hard to get time to do that. And also I work full time, so it's hard to get that time.
As clinicians, we've just been, challenging ourselves to say, how are we to be more immediately available in a meaningful way?
Coming from a small community may be as well that the service doesn't exist, and so it might mean more real burden on patients and families to say to them, you have to get in your car and drive an hour or 2 hours to the local mental health site for some counseling service. And they're saying, like, I need the support, but that's not doable because I can't really leave home right now. I need to be there with my family. I think it's probably more than 10 years ago that telehealth was introduced to us. For Northwestern Ontario, it's essential, I think, because so many of patients and families live in the region, and now really getting more comfortable with technology, with computers, Skyping, things like that.
It enhances the experience for the patient, and more than anything, it helps to empower them. And really, I think at a time when people are feeling vulnerable, feeling like you have the information that you require so that you can take action, puts you in a position where you feel like you have power. And I think this is very essential at a time when you're feeling vulnerable.
So they started Care to Talk, which was an online forum and chat group, and that was really nice because I could log on in the evening after the kids were in bed, and
we'd sit and watch. I'd watch TV, and he'd sit on the computer, on the laptop on the couch, and we'd just have some time together. But he'd be doing his thing, and I'd be doing my thing, and it was nice because you could talk with people at home and still not take time from us because there's only so many daylight hours in a day.
There are mechanisms, whether it's chat rooms, we call it MOVI, it's a secured, through the OTN network, Skype type application, or picking up the phone or texting. The younger people are often saying, I can't be bothered with emails. It's just too time consuming. I don't have to go to my computer. I don't have to look for my laptop, but I'll text back and forth. So I've been texting, and it's just much more, I've said the word a few times, immediate and responsive to patients. And then they say, that was exceptional, that was excellent, thank you. As we rely, myself included, more and more on technology, the most important thing really is the relationship, is the interaction, is the connection. And if they get that message from us, that we are always available, even just in sound bites here and there, I think that will make a significant difference to people. I know it does.